Yeah, no, it's a great question, and thank you for taking the time to chat about this. I think when we talk about maternal mortality in the U.S., the conversation usually centers on those causes that we think of as more medical or more obstetric, things like hemorrhage or hypertension. And, and I think over the last several years, there's been growing recognition among clinicians and researchers alike that non-obstetric causes, especially overdose and violence, may be playing a larger role than we realize. And so we wanted to look at national mortality data to better understand how often overdose, homicide, and suicide contribute to maternal deaths. And, to be clear, the goal of this study was really simply descriptive. It was to clearly define the pattern at a national level and not to explain why it's happening or to evaluate specific policies. And I think and I hope that it will create an impetus to do studies that answer those questions because I think they're important questions. They're just not the ones that we focused on in our study. I think the fact that overdose was the single most frequent cause of maternal death was just absolutely striking. I think the frequency of homicide and suicide have been talked about previously over the course of the 2000s and 2010s, but being able to look at that nationally and really show that it was one of the leading causes as well was a striking finding. And I think for clinicians, the fact that a meaningful proportion of the deaths that are occurring during pregnancy are due to causes that fall outside of our definition of traditional obstetric complications is important. It's not making those hemorrhage and cardiovascular disease causes less important, but I think it broadens how we need to think about maternal risk when we're taking care of our patients. I will say that our study looked at pregnancy in the first 42 postpartum days only. And so it is a bit of a disparate time period. We're thinking of the 9, 10 month, the 40 weeks of pregnancy versus the 6 weeks postpartum. And so the frequency of death in the postpartum period, based on, I suspect that thinking about the amount of time that there is there, that's a very important period to focus on. But that doesn't mean that it's any less important to focus during pregnancy. And I think while we didn't look at these interventions, early screening, repeated screening over the course of pregnancy to identify folks early on who might be at risk of these complications um, is important. And just some things that come to mind that have been shown to be effective in other fields, maybe not as much in ours, are screening for substance use, screening for presence of a firearm, screening for mental health disorders and intimate partner violence, um, starting early in prenatal care and being revisited over time. Pediatric populations over the past several decades, there's been a major push to look at asking folks about the presence of firearms, safety in the home, and have shown that even the act of asking and identifying those children at risk of death by firearm by identifying where the firearms are is helpful in reducing death in that population. And so I think that, it's something that would need to be built into health systems, right? It's not enough just to ask and identify, but you have to have a way of connecting people to resources, which means those resources have to exist. And so I think this is something that, is easy to implement in clinical practice to ask as part of your history. Are you experiencing intimate partner violence? Are there firearms in the home? Questions about mental health that are already incorporated in a lot of our prenatal care. But more importantly, even than identifying it, is that linkage to resources afterwards. And I think that's where um, bigger scale interventions and thinking about the way that we structure our care systems is important. There's rich literature, I think, looking at the way that we as clinicians should be interacting with patients, talking about sensitive topics such as mental health, substance use, intimate partner violence. And I think that this underscores the importance of clinicians seeking out that training, seeking out those studies and that work to understand how best to do it. I think there are many people in our field who have made that their primary focus and yeah, yeah, yeah. I mean, I think it's all about asking the questions with the intention of helping the patient, not necessarily the intention of identifying it in order to penalize it or identifying it in order to just check a box, but really to follow through and do what a patient needs in order um, to address an issue that's going on. I mean, I think the biggest takeaway is that this is a start. This is an identification of an issue and a prioritization of an issue with a call to, for clinicians and researchers to look into these topics in much greater detail. I mean, some things that our group is planning to do is look a little bit further postpartum, see what's happening after that first 6 weeks and going all the way out to a year postpartum, and also understanding how specific state level policies may impact maternal mortality as they are passed, both policies that are, protective or policies that in some cases are not protective of maternal health, and understanding how at the national level and at the state level we are making changes that are impacting maternal health.